Parents of children with epilepsy appealed to the Senate for help. They seek the passage of a law granting easier access to medical cannabis or marijuana, believing it can alleviate their children's condition.
We have around 80 patients who died already on our advocacy. And we cannot afford to wait for longer time. Yung anak ko po, recently nag-seizure po siya. And pag nag-seizure po siya, namamatay po siya. So nawawalan po siyang hininga. That's why kahit sobrang hirap, talagang pinaglaban po namin to.
The problems, they say, are the taxing process in securing a compassionate special permit, plus the high cost of medical marijuana in the country.
Kahit po may trabaho po kaming mag-asawa, Senator Bina, hindi po namin kaya ang 1.6 million pesos na halaga ng Epidiolex.
Some senior citizens also want to use it as an alternative to their multiple maintenance medicines. This is the first hearing on the bill filed by Senator Robin Padilla. Similar proposals failed to hurdle Congress in the past. The University of the Philippines, Manila earlier said there's no sufficient evidence that cannabis can treat any disease. Further research is needed, according to the National Institute on Drug Abuse in the U.S., where medical cannabis is allowed in some states. It adds, not much is known about its long-term impact on patients. But advocates insist there's also not enough evidence on the supposed negative effects of medical marijuana.
Kesyo, mabubuwang daw yung mga gumagamit, psychosis, mga-aksidente, motor vehicle accidents, respiratory problems, at kung ano-ano pa. Nakakatakot po yan. Wala po sa amin dito ang may gusto niyan. Wala pong serious na side effects or death na pagkamatay po dahil sa cannabis.
Public health advocate Tony Leachon says he's open to the proposal, but he's worried the law would be abused, giving rise to addiction. He says legislation should cover only serious medical conditions and prescriptions should be strictly followed.
I'm trying to listen, but ang doktor kasi pag nanumpa sila sa Hippocratic Oath, mas matindi sa amin yung first do no harm rather than efficacy.
Senators assure a science-based decision with enough safeguards. Expect debates even within the chamber.
Napakalinaw naman na hindi raw form ng cannabis yung gagamitin.
Here in the Philippines, it might not be acceptable.
Padilla will next invite resource persons who oppose wider access to medical cannabis. Eimor Santos, CNN Philippines.